cruise ship outbreak has left multiple people dead, and there are questions about how it started. 2 Dutch people and a German national have died from the hantavirus while on a cruise ship run by Ocean-Wide Expeditions. The ship was in a South African medical facility following the health complications of 6 passengers. Named the MV Hondius, the ship was carrying about 150 passengers from various countries and began its journey 3 weeks ago. The virus typically spreads by having contact with rodents like rats and mice, primarily when exposed to the animal's urine, droppings, and saliva, but it can also spread through a bite or scratch as well. The hantavirus can lead to hantavirus pulmonary syndrome and hemorrhagic fever with renal syndrome. Hantavirus pulmonary syndrome is a severe disease that affects the lungs 1 to 8 weeks within contact of the rodent. Early symptoms include fatigue, fever, and muscle aches, followed by coughing and shortness of breath. 38% of people who develop respiratory systems die from the disease. Hemorrhagic fever with renal syndrome, or HFRS, develops 1 to 2 weeks after exposure and affects the kidney. The symptoms include intense headaches, back and stomach pain, fever, chills, nausea, and blurred vision. HFRS fatalities depend on the severity of the virus, with a 5 to 15% fatality rate. Although typically hantavirus is transmitted through rodents, there is a possibility that human-to-human transmission was the cause of the outbreak. The WHO Director for Epidemic and Pandemic Preparedness and Prevention assured reporters the risk to the general public is low. Share your thoughts about the virus in the comments. Follow for clear, fast breakdowns like this.